Dear students, welcome back. In the previous session, we have discussed about the wrist instability. In this session, we are going to discuss about the muscles of the wrist complex and its role. Okay, the primary role of the muscles of the wrist complex is to provide a stable base for the hand while permitting positional adjustments that allow for an optimal length tension relationship in the long finger muscles. Information on a muscle's cross-sectional area and the length of the momentum will help to facilitate understanding of a muscle's specific action, force and torque potential. Many researchers like Hazelton and Associates investigated the peak force that could be exerted at interphalangeal joints of the fingers by the long finger flexors during wrist positions. And the study found that the greatest interphalangeal flexor force occurs with ulnar deviation of the wrist, while the least force occurred with the wrist flexions. Okay, some other studies concluded that 20 degrees to 25 degrees of wrist extension with 5 degrees to 7 degrees of ulnar deviation was the optimal range to maximize grip strength output. However, the muscles of the wrist are not structured merely to optimize the force of finger flexion, and as for this, so many controversies are present on these studies to understand these functions of these muscles by considering any one of the factor or function. So, the function of the wrist muscles cannot be understood by looking at any one factor or function. It should be assessed only by EMG, that is electromyography, in various patterns of use against the resistance of gravity and external loads. Then only we can assess the function of the muscles of the wrist complex. Okay, so that in that only we can identify the specific action and the muscle force and also the torque potential. Okay, without EMG we can't assess the exact muscle functions of the wrist complex. Okay, so now in this session we are going to understand the role or the function of these muscles at the wrist complex. So there are two kinds of musculature which involves in the actions of the wrist. One is the volar wrist musculature and dorsal wrist musculature. That means volar wrist musculature means the muscles which are crossing anteriorly over this wrist joint will help in the action of the wrist. Okay, the dorsal aspect musculature which acts on the posterior side of the wrist, which mainly helps in wrist extension, whereas the volar aspect muscles, so these are volar aspect muscles which helps in flexion, wrist flexion of the wrist joint. Okay, or wrist complex, we can say wrist complex. Okay, now so there are these muscles are the muscles present on the volar aspect. Okay, yes. So as we know that on the anterior side or anterior aspect of the forearm we are having 8 muscles. Out of these 8 muscles, 5 are superficial and 3 muscles are deep. Except pronator teres and pronator quadratus, the remaining 6 muscles which are going to cross the anterior aspect of the wrist. So the tendons of those 6 muscles are: one is the palmaris longus, flexor carpi ulnaris, and the flexor carpi radialis. So these are the superficial muscles, and also the flexor digitorum superficialis. All these 4 muscles are the muscles which are present superficially on the flexor aspect. Okay, and the remaining muscles, that is the flexor digitorum profundus and the flexor pollicis longus, these two are the deep muscles which are placed on the anterior aspect of the forearm. These are the 6 muscles which are crossing olarly. Out of these 6 muscles, the palmaris longus, so here you can see this palmaris longus muscle, and then flexor carpi radialis. So here you can find this flexor carpi radialis muscle. So this is the tendon of flexor carpi radialis, and next one is the flexor carpi ulnaris. Here you can find this flexor carpi ulnaris. So these are the 3 muscles. So the first 3 muscles are the primary wrist muscles. So these 3 muscles are called as primary wrist muscles. And the next 3 muscles, that is flexor digitorum superficialis. Here you can find this flexor digitorum superficialis, and also flexor pollicis longus and flexor digitorum profundus. So these 3 muscles will have primary actions on the digits, whereas the secondary actions at the wrist. All these muscles pass under the flexor retinaculum of the wrist. So these are the flexor retinaculum of the wrist, except the flexor pollicis longus. Except flexor pollicis longus. Okay, sorry, except palmaris longus. Except palmaris longus, the remaining all muscles will pass under the flexor retinaculum. This is the flexor retinaculum. Out of 6 muscles, palmaris longus will pass superficially over the flexor retinaculum, and it continued as palmar aponeurosis on the anterior aspect of the hand. Okay, now we will see the functions of these 6 muscles. Okay, and below this flexor retinaculum you can find the tendons here. Okay, one is here you can find this bursae is present. In between these bursae you'll have this 4 tendons, 2 tendons above and 2 tendons below. This tendons belongs to flexor digitorum superficialis. Below these 4 tendons you'll find the tendons of flexor digitorum profundus. This is flexor digitorum profundus tendons. Okay, now all these tendons are going to supply the fingers, and also you can see the flexor pollicis longus, which is also deep muscle, which is also supplied to the terminal phalanx. Okay, so the main function of this flexor retinaculum is it helps all these tendons in place, and it also prevents the bowstring of this flexor tendons during flexion. Okay, these are the function of this flexor retinaculum. Now we will see this action of this individual muscles. Okay, the first one is the flexor carpi radialis and the flexor carpi ulnaris. So the positions of these two tendons as they cross the wrist complex indicate that these two muscles will help in radial deviation as well as ulnar deviation respectively. However, EMG evidence shows that the flexor carpi radialis is not significantly effective in radial deviation, but radial deviation of the wrist in an isolated contraction. But along with palmaris longus, they contribute or they function as a pure wrist flexor. The flexor carpi radialis must contribute something to the radial deviation. However, since it is active when pure radial deviation is performed. When pure radial deviation is performed without wrist flexion, then this flexor carpi radialis is active. Okay. If you see the flexor carpi ulnaris tendon, if you can see the position of this tendon, okay, this tendon crosses the wrist further from the axis for wrist radial and ulnar deviation. So we know the center of rotation of this thing, that is capitate. When you consider this, the tendon is passing far away from the axis than the flexor carpi radialis. So this flexor carpi ulnaris tendon and this muscle will have more effective in its ulnar deviation function than the flexor carpi radialis in its radial deviation function. Okay, and this flexor carpi ulnaris also passes or envelops over the pisiform bone, which is a sesamoid bone, that increases the flexor carpi ulnaris momentum for flexion and extension. So finally, the flexor carpi ulnaris is effective in both flexion and ulnar deviation of the wrist complex. So this is the function of flexor carpi radialis as well as the flexor carpi ulnaris. That means flexor carpi radialis in an isolated contraction, it is not acting as pure radial deviator. Along with palmaris longus, the flexor carpi radialis acts as a pure flexor. If wrist flexion is not occurring, only pure radial deviation is occurring, then the flexor carpi radialis becomes active in that action. Okay. And when you come to this flexor carpi ulnaris, because of its position of this tendon, which is away from the center of axis of radial deviation and ulnar deviation, this flexor carpi ulnaris acts an more effective ulnar deviator, and also it is crossing over the pisiform bone. Because of its position, the flexor carpi ulnaris is having more momentum, which helps in wrist flexion and extension also. So these are the functions of flexor carpi ulnaris. Now we will see the next function of this thing, the wrist musculature is. So we have seen this flexor carpi ulnaris, flexor carpi radialis. Now the next muscle is the palmaris longus. So the palmaris longus muscle is a wrist flexor without producing either radial deviation or ulnar deviation. So the pure wrist flexor without producing either radial deviation or ulnar deviation is the palmaris longus. So sometimes this palmaris longus muscle and tendon are absent unilaterally or bilaterally in approximately 14% of people without any apparent strength or functional deficit, because it is acting as wrist flexor. So the wrist flexion is carried out by other muscles also. So the deficit is not seen if the muscle is present or absent. Okay. And because of its because of this unneedful function, so this palmaris longus tendon is used for surgical reconstruction of other structures. That means if this tendon is removed also, there is no functional deficit is seen. Okay, so this is the importance of this palmaris longus muscle. Next come to the other group of muscles, that is flexor digitorum superficialis and flexor digitorum profundus, as well as the flexor pollicis longus, or predominantly the flexors of the digits. As these muscles are multi-joint muscles, their capacity to produce effective force at the wrist is dependent on a synergistic stabilizer to prevent full excursion of more distal joints. Okay. If these muscles attempt to act over both the wrist and the more distal joints, they will become actively insufficient. So these muscles will become actively insufficient if these muscles are going to act both at the wrist as well as the distal joints. So for example, if these muscles are shortening at the wrist joint as well as the fingers, it is going to be actively insufficient. Okay. But as this FDS and FTB shows varied activity in wrist radial ulnar deviation, as one might expect from the central location of the tendons. So because of its position, so these two muscles will show some activity in the case of wrist radial and ulnar deviation. And this, the superficialis, the flexor digitorum superficialis, seems to function more consistently as a wrist flexor than the profundus. So out of these flexor digitorum superficialis and profundus, the superficialis is having more function as a wrist flexor than the profundus. Okay, so we can think logically also. This FTB is a longer muscle and crosses more joints, and because of this crossing of more joints, it has more action on the digits than at the wrist. Okay, so the effect of flexor pollicis longus, next muscle, that is the effect of flexor pollicis longus on the wrist, has received relatively little attention. That means it is having very little function at the wrist. So the position of the tendon suggests the ability to contribute to flexion and radial deviation of the wrist. Because of its position of this, so it is present on the lateral aspect. So because of that, the position of the tendon, it is having an ability to cause flexion of the wrist as well as the radial deviation of the wrist if conditions are applied. So when such a work is done by flexor pollicis longus means, so when the distal joints are stabilized, then only the flexor pollicis longus can exhibit such kind of function. Okay, so if it is not stabilized, it will not show the wrist flexion and radial deviation function at the wrist. So this is all about the muscles which are present on the volar aspect. Now we are going to see the next wrist musculature, that is dorsal wrist musculature. So here comes the dorsal wrist musculature. So the dorsal wrist musculature mainly helps in the extension as well as the radial and ulnar deviations also. Okay. So on the forearm also we are having many extensor muscles. Almost 12 muscles are present on the dorsal aspect of the forearm. Out of 12, only 9 muscles are crossing the wrist. Okay, and these muscle tendons which pass under the extensor retinaculum. Here this is the extensor retinaculum, which is divided into 6 compartments here. So 1, 2, 3, 4 and 5. So how many compartments? 6 compartments. So through this extensor retinaculum, all these 9 tendons passes. Okay. So what are the 9 muscles which are crossing this dorsal aspect of the wrist complex? Okay, the muscles are extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, and so these 3 muscles are the primary wrist muscles. Out of 9, these 3 are primary wrist muscles. The other 6 muscles are finger and thumb muscles. Okay, that may act secondarily on the wrist, and these are extensor digitorum, extensor indicis, extensor digiti minimi, the extensor pollicis longus, the extensor pollicis brevis, and the abductor pollicis longus. So these 6 muscles are secondary wrist muscles. Okay, here all these tendons of 9 muscles pass under the extensor retinaculum, which is divided into 6 distinct tunnels by septa. As the tendons pass deep to the retinaculum, each tendon is encased within its own tendon sheath to prevent friction between the tendons and the retinaculum. The septae of the retinaculum through which the tendons pass are attached to the dorsal carpal ligaments and help maintain the stability of the extensor tendons on the dorsum, as well as allowing those muscles to contribute to wrist extension and preventing bowstringing of the tendons with active contraction. So this is the function of this extensor retinaculum. If you can see this on these 6 compartments from radial to ulnar side, this is the radial side and this one is the ulnar side. From radial to ulnar, each compartment, now we can see what are the tendons are passing in each one. So in the first compartment, the abductor pollicis longus and extensor pollicis brevis muscles share a compartment, and the next one is extensor carpi radialis longus and extensor carpi radialis brevis, and the third compartment shares only one muscle, that is extensor pollicis longus. In the fourth compartment, it is occupying by 2 tendons. One is the extensor indicis. So EIP means extensor indicis proprius. Okay, and also next muscle in this is extensor digitorum. So these are the two muscles which share this fourth compartment, whereas in the fifth compartment again it is having only one muscle, extensor digiti minimi, and the last compartment is also having only one tendon, that is extensor carpi ulnaris, from radial to medial. This is the arrangement of these tendons. Okay, now we will see the functions of these things, of these muscles. So the first one is the extensor carpi radialis longus and extensor carpi radialis brevis together make up the predominant part of the wrist extensor mass. What are these two muscles? Extensor carpi radialis longus and extensor carpi radialis brevis. These two muscles which are present in the second compartment, okay, which mainly shows the activity during wrist extension. Okay, and one study found that extensor carpi radialis brevis is active during all grasp and release hand activities which occurred in pronation, and this is not active when these activities done in supination. Okay, and extensor carpi radialis longus shows increased activity when either radial deviation or support against ulnar deviation is required, or when forceful finger flexion movements are performed. In all these cases, the extensor carpi radialis longus is showing increased activity. Coming to the extensor carpi ulnaris, this extensor carpi ulnaris extends and also ulnarly and ulnar deviation at the wrist. So this extensor carpi ulnaris extends the wrist as well as helps in ulnar deviation. It is active not only in wrist extension but frequently in wrist flexion also. Okay. Some of the investigators hypothesized that extensor carpi ulnaris activity in wrist flexion adds an additional component of stability to the structurally less stable position of the wrist flexion. This is one of the important function of the extensor carpi ulnaris. Okay, and this is not needed on the radial side of the wrist, because which has more developed ligamentous and skeletal control. When the forearm is pronated, the crossing of radius over the ulna causes the reduction in the moment arm of the extensor carpi ulnaris, making it less effective as a wrist extensor. During pronation, this extensor carpi ulnaris is less effective when it is in when the forearm is in supination. And now coming to the extensor digiti minimi and the extensor indicis. So extensor digiti minimi and extensor indicis insert into the tendons of the extensor digitorum. So if you go back to this anatomy, then you can find these two muscles, as we know that the extensor digitorum is going to divide into 3 slips, isn't it? So, and these slips are going to attach the phalanges. Okay, and this extensor indicis as well as this extensor digiti minimi is also going to divide 3 slips. So one of this lateral aspect of the extensor digiti minimi slip is going to insert with the tendon of the extensor digitorum, as well as the radial aspect medial aspect of this extensor indicis, which is going to inserted with the tendon of the extensor digitorum. So therefore it is having a common function with the extensor digitorum. So the extensor indicis and extensor digiti minimi are capable of extending the wrist, but wrist extension is credited more to the extensor digitorum. So along with extensor digitorum, these two muscles are going to help in wrist extension, but the maximum wrist extension is brought about by this extensor digitorum. Okay, the extensor digitorum is a finger extensor muscle. Okay, but functions also as a pure wrist extensor also. Okay, so here appears some reciprocal synergy of the extensor digitorum with that of the extensor carpi radialis brevis in providing wrist extension. Okay, so because of this small muscle, that is extensor carpi radialis brevis, because of this small tendon which mainly helps in the wrist extension, okay, when compared to the extensor carpi radialis longus. Okay, so when we compare with the extensor digitorum and extensor carpi radialis brevis, the ECRB, that is extensor carpi radialis brevis activity is seen when the extensor digitorum is active. Okay, next, the three extrinsic thumb muscles that cross the wrist do not contribute much to the function of the wrist. One is the abductor pollicis longus, extensor pollicis brevis, which are having the capability of radially deviating the wrist and may serve a minor role in that function. Okay, so generally the wrist deviation detracts from the prime action on the thumb and necessitates a synergetic contraction of the extensor carpi ulnaris to offset unwanted motion. So that is the main function, we have to consider it. So if these two muscles are going to act on the wrist, so these two muscles are going to deviate from its normal function. So these two muscles may offset the unwanted motion of the extensor carpi ulnaris. When ulnar deviators are absent, the thumb extrinsics may produce a significant radial deviation deformity at the wrist. Okay, and the little evidence has been found to indicate that the more centrally located this extensor pollicis longus has any notable effect on the wrist. So these are all the functions of the dorsal wrist musculature and also the volar wrist musculature. So in the next session we are going to see another interesting topic, that is hand complex. Thank you.